Namaste. I am Arunjit, Director of Matha, coming to you from the beautiful city of Trivandrum. We are joined today by our Chief Physician, and I am currently at our hospital in Kodapanakundan. Today, let us use this opportunity to ask our Chief Physician to explain what is Ayurvedic eye treatment in a nutshell. Do we do treatments in the eye, or do we do treatments on the head, or do we do treatments all over the body, or is it internal medicine, or is it internal medicine and treatment? What exactly is Ayurvedic eye treatment in short?
Okay. To explain the eye treatment in short is not so easy because treatment means to cure a disease, and diseases are innumerable. Numerous diseases are there, and the treatment also varies from one another according to the disease. Still, I will try to explain the basic factors, basic elements for the Ayurvedic eye treatment. The first step is always to diagnose a case correctly. To diagnose means to analyze or study that particular disease in such a way so that we can chart out a line of treatment. If you are not able to start a treatment on the basis of diagnosis, that diagnosis is nothing, a big zero only. So, this diagnosis is the first and most important thing in Ayurveda. And we know Ayurveda is always based upon the Tridosha theory. Tridosha means Vata, Pitta, and Kapha. So, a thorough knowledge about these factors, these three these pillars, Vata, Pitta, Kapha, is very, very important. And all the signs and symptoms of the disease and the other factors such as his personal changes, even in his character, his mental status, his tolerance level, everything is to be analyzed on the basis of these things. And finally, we had to come to a conclusion. What is the dominant dosha? What is the associated thing? Where is the affected site? And what is the impact of this pathology on that particular organ and that particular functions of that organ? This is the first step of the treatment in Ayurveda. Then comes the selection of drugs for that particular condition. In Ayurveda, the drugs also are analyzed and described on the basis of the Tridosha theory. That means a particular drug is having this particular property on that particular dosha. That means we will say Vata Shamana, Pitta Shamana, Kapha Shamana, like that. So we have to select that particular drug which acts on that dominant or vitiated dosha. That is the next step. But each dosha is having so many properties, and in a particular disease, all the properties of that vitiated dosha may not be in equal proportion. So we have to consider the dominant vitiated property also. That is very important. That means sometimes we can see one dosha or pitta, if you are considering pitta, pitta is having different properties and only one among them may be more dominant. So we have to select a drug which will subside that particular vitiated dominant property. Simply say pitta, to cure pitta is not at all enough in Ayurvedic theory. Then one more thing is there, even though we are selecting a drug for a particular dosha, we have to think whether it will act properly in the ophthalmic tissue. Because all drugs will not act in all organs or all structures of the body. For example, I will say, take muscle, we can say muscular structure. The cardiac muscle is entirely different from that of calf muscle on the muscles of the leg, because the functions are different, properties are different, actions are different. So we have to select a particular drug which will act on that particular organ, even though the dominant dosha is same. So there is a group of drugs or anything, not only drugs, consumable or this wearable, whatever it may be. So many factors are there. So we have to select that group of things which will act positively in the ophthalmic tissues. This group is known as Chakshusya. So we have to select Chakshusya drug for the treatment of eye, so that we can assure that it will act properly or in its full swing on the ophthalmic system. That is very important. So if there is a disease which is having dominance of pitta, we have to select a drug which will act on the pitta, especially in the ophthalmic tissues. That is the importance of the selection of drug. Then the third point is mode of preparation. Okay, we have already selected a drug which will act on the ophthalmic tissues, but we have to take a step how this is to be introduced in the eye. That is another point, because the structures of the eye are highly different from one another, because when we come to cornea, the actual it is purely transparent, but the next area is sclera, which is totally completely opaque. So when we consider disease of cornea, we have to select some disease which will act on the cornea, because this part is having its own dominance. In the structural level also there is dominance of the each dosha. So if, for example, if the sclera is Kapha dominant, we have to select a Kapha dominant which will act on the Kapha, and that only should be selected for the treatment of scleral disease. We cannot take a general Kapha Shamana drug. So the preparation is important in this particular point. When we apply a medicine in the sclera, it should be possible to get absorbed through the scleral cells, which is opaque in its nature. And when we apply a medicine on the corneal disease, it should be possible to act on the corneal tissues. Like that, to achieve this goal, very specific preparations are there in Ayurveda. That is, in some ways, if it is proposed to have some vascular absorption, it should be prepared in such a way, and then only we can use it in the vascularized area. Like that, the theory is very deep, it is not possible to explain everything now, but the preparation is very important, whether in the powder form, whether in the decoction form, or the medicine. These drugs are to be medicated with the ghee or medicated with the oil, like that. This is very important. This preparation is to ensure the maximum level of absorption and maximum level of assimilation. So that is the third step, selection of the preparation of the particular drug. There are very, very specific, highly different preparations are there. Then comes mode of application. Okay, we have already selected drug and already prepared a particular medicinal form. Then how it is applied, that also is very important. It is not instilling or applying one drop in the eye. It is not like that. Application is this modified or formulated to get the maximum level of absorption. Because if we apply a medicine just in a liquid form, how much it will be absorbed in a corneal disease, or how much it will be absorbed in a retinal disease. This is very important. So to achieve the maximum level of absorption, the mode of application also is important. The main methods are, we'll say Aschodhana, then Sega, then Tarpana, then Padabhaga, and then this comes this Vidalaga. Like the different methods are there. So in a particular site, a particular mode of application only will give maximum results. So we have to start from the diagnosis, then selection of drug, then selection of preparation, then selection of the mode of application. If all these steps are according to science and correct, then we will get the maximum result, no doubt.